Audio.
Good evening, everyone. We welcome you to this, our virtual Zoom, our time to be together once again. We thank you for over 2 years for coming out on Mondays in order that we can be lifted, in order that we can be educated. Let us pray. Eternal God, our Father, we thank you for all who have gathered. We thank you for those who are streaming live and those who will be coming on in order to be educated. We thank you for this branch of Zion, and we thank you, O God, for our presenter. May all that we learn tonight not stay with us, but that we can tell someone else in order that they too can be lifted. We pray this prayer in the name of Jesus Christ. Amen. On tonight, we are very happy to have with us Miss Danielle Holdren. She will be receiving her Doctor of Pharmacy degree from Virginia Commonwealth University in just a few months, and we congratulate her on that. I know she already sees it, so it's going to happen in May of this year. We reached out to Dr. Brown, who is the owner of Hope Pharmacy in Church Hill, in the only grocery store in Church Hill. And we welcome Ms. Holdren. Ms. Holdren, it's all in your hands.
Awesome. Thank you so much. So again, I'm a fourth-year pharmacy student at VCU, and I will be graduating in May. I am currently spending 5 weeks with Dr. Brown at Hope Pharmacy on a clinical rotation, and so she allowed me to put this presentation together and just share a little bit more about influenza, RSV, and COVID. All right. And so today I'm hoping to review the prevalence and distribution of these viruses within the US, to recognize key differences between these viruses. As you will see, there is a lot of overlap. We'll also summarize some techniques for managing these viruses, and we'll discuss some methods for preventing the spread of these viruses. So we will start with influenza, also known as flu. And so typically we will see every year that we have a flu season, and this is referred to as an epidemic. So it is a widespread occurrence of an infectious disease that's going to be happening in a community at any given time. Our flu season typically runs from October, so early fall into early spring. So I've kind of shown here on the right a visual image of what the prevalence is looking like specifically in the Virginia region during those times. And so you'll see in October, we're starting to pick up some cases in that moderate area. And as we go through the winter months, it gets to a pretty elevated number of cases. And within February, we're starting to decline. So that's our typical range of flu season here in the US. This is a respiratory illness that's going to affect the nose, throat, and in severe cases, the lungs. And it can cause, again, mild to severe illness. Really, most of the time in healthy individuals, this is an infection that can be overcome without really much of anything. A lot of times just rest and fluids is going to be enough to get you recovered. However, we do have some high-risk populations, high-risk patients to keep in mind. So a lot of older adults are just at a higher risk in general. You start to see your immune system weaken as you age. And so those adults might have a higher risk of becoming infected with flu. Young children whose immune systems are still developing, again, might have a harder time fighting that virus if they become infected. So they're another high-risk population. Pregnancy, chronic health conditions such as asthma, diabetes, and autoimmune disorders where that immune system might be a little bit impaired, all people that we need to look out for in terms of protecting them and being a higher risk. And so every year, we do have a flu vaccine that is developed, and a lot of the times we develop that vaccine based off of trends that we're seeing around the world. So different countries have their flu seasons at a different time than the US. So for instance, Australia and New Zealand, those are countries where their flu season is opposite of ours. So their flu season will run from April to October. And then ours picks up in October and subsequently runs the opposite end. And so from that, we are actually able to gather a lot of research throughout the year to develop pretty accurate vaccines. And so when we look at influenza, it's really a group of viruses. Like most viruses, it's going to have multiple variants and strains that we have to look out for. And so the 4 variants that I have listed here are the only flu variants that are known to cause infection in humans. And then at the top there, the A and B variants are the ones that are most common and the ones that really cause our flu epidemics here every year for our flu season. And so these viruses, really the way that they differ is their makeup and the receptors that they have. And so within even the A group of viruses, you can see that there are over 20 different subtypes. And so because of that, these viruses are able to change every year. So whenever we have a vaccine, we have to update it because the virus can actually become stronger to be able to evade that kind of protection that we've put up against it. So they're actually very smart, these little viruses. But again, the A and B are the ones that we primarily focus on and that we develop our vaccines based off of. And so looking at flu symptoms, it's really a wide range of symptoms from cough to fever, and body aches is something that's really typically severe with flu if you ever become infected. And so looking at how it spreads. So this is a virus that's going to spread through respiratory droplets. So anytime you cough, talk, sing, sneeze, you're releasing respiratory droplets into the air. And so anybody that is within 6 feet of you can easily become infected with that flu virus if you happen to have that virus. Another way that you can become infected is by touching contaminated objects. So if you go and touch a door handle that might have a flu virus on it from somebody that touched it before you, and then you subsequently touch your nose, your mouth, your eyes, those are different ways that you can infect yourself. And that's why using those proper sanitary precautions is really important in preventing the spread of every virus. And so the flu virus, this can be actually transmitted before you even start to show symptoms. So typically within 2 days of becoming exposed to the virus, you can actually start spreading the virus, even though you might not be symptomatic. And so again, as you are infected with the virus in your body, the virus is actually replicating. So you'll have a time period where you will be the most infectious, and that's 3 to 4 days after you are exposed to the virus. And then within that, you will typically have symptoms 7 to 10 days. So typically this is going to resolve in less than 2 weeks. And so again, the virus does primarily target the upper respiratory tract, so the nose, the throat. So a lot of the times that's why you have that cough and you have the runny nose, is because that's where the virus is actually attaching itself and replicating and causing that immune response. And so when we go into management of flu, so we have a wide array of vaccinations available, and I'll go into these vaccines in more detail because they just vary slightly. And then we also have different testing modalities that we can use as well. Similar to with COVID, we have rapid tests and we have our PCR test. Rapid tests will typically return results within about 15 minutes. And our PCR test is a little bit more in depth. Again, you'll get swabbed and you should get results within a couple of days or so. And then we do have several treatments. The most popular, I would say, being the Tamiflu, which I have bolded here at the top. But we'll go through each of these treatments in detail and kind of see the differences between them. So we'll start with vaccination, and just to emphasize, becoming vaccinated is the primary method of preventing influenza as well as COVID, which again, we'll go into that in more detail, but vaccines are so important to controlling these viruses. And I think one of the misconceptions that we often think about with vaccines is that you're injecting yourself with the virus and you're going to become infected. And that's not entirely true. So with a vaccine, yes, you are putting a particle or a piece of the virus into your body, but it is not enough that it will actually infect you. It's not enough to even cause replication within the body, but it's just enough to kind of stimulate your immune system to build antibodies, to build up a defense against that specific virus. So if you ever become exposed to an actual amount of virus that can affect you, then your immune system will have already seen it and already has its defense mechanism up. So I think that's a really good way to kind of look at vaccinations and overcome that stigma of, well, I'm injecting myself with this virus. So again, it's going to promote the production of antibodies within your immune system. And after you become vaccinated, it typically takes about 2 weeks to actually build up that immunity. And so, as I mentioned, the flu vaccine is reviewed annually, and it's updated to protect against those different strains of viruses. But each of the vaccines that we have annually is going to be a quadrivalent vaccine, and so that means that it protects against 4 different strains of the virus. And those 4 different strains are going to be within that A and B that I mentioned earlier, being the most common that infect us during our flu epidemics. So when we look at our different vaccines that we have available, we do have a standard dose, which is typically recommended for everyone 6 months and older. And I want to point out one of the key differences within our standard dose is that some of them actually have egg in the formulation. So it's really important, if you do have any sort of egg or dairy allergy, to understand which vaccine you're getting to prevent any sort of reaction. So the 4 listed there in the standard dose at the top, those are going to have some sort of egg in the component. And really, that's just in the way that the vaccine is composed and how the virus is grown. Sometimes they will use egg to produce that. So we do have a standard dose that is egg-free, and that's the Flucelvax listed there. So keep that in mind if you do need that requirement when you get your flu vaccine. And then we also have high dose vaccines, typically recommended for our patients that are 65 and older. And again, we have a couple of different options here, one with the egg in the formulation and one without. So another thing to keep in mind. We also have a live flu vaccination, and this is actually an intranasal nasal spray. So with that vaccine, it's really important to avoid in our patients that are immunocompromised. So anybody receiving like active chemo or undergoing HIV treatment, those sorts of things, pregnancy, those are all patients that we want to avoid the live vaccine in. And then I have at the bottom here listed other. This is another flu vaccine that is egg-free, but also this vaccine is a little bit stronger than the standard dose. So it's another one that can be used for our age group 65 and higher. And so looking at the optimal timing of vaccination, this is a question I get asked every single flu season, is when should I get vaccinated? So typically most pharmacies actually start receiving the stock of their vaccine around August, so late summer. And honestly, it's getting earlier and earlier that these pharmacies are getting them in and pushing these vaccines on their patients. But it is really important to get your vaccine at the optimal time, because when you do elicit that immune response, you start to build those antibodies, that immune response is going to actually wane over time. So in order to have protection throughout the peak of the flu season, you want to be sure that you're getting vaccinated in the September to October timeframe. That's the best time to get vaccinated. Where can you get vaccinated? Really, there are a lot of different resources, especially for flu vaccines nowadays. You can go to the Virginia Department of Health, and they have a wide array of vaccines that they offer there. Most community pharmacies do offer a flu vaccine. We do at Hope Pharmacy. We have several different options to choose from. You can go to many different clinics throughout Richmond. And also, if you are a VCU student or employee, the health center has a bunch of different vaccines as well, including flu. And so, as I mentioned, every patient 6 months or older should receive a dose of the flu vaccine. Greater than 65 is where the high dose is really recommended. However, I will point out that if you happen to go somewhere and they don't have the high dose in stock, it is still very important to receive your vaccine, even if it is a standard dose. Because if you are in that age group, you are higher risk. And so any dose is better than none. And then within pregnancy, it is also recommended to get a standard dose. And with pregnancy, specifically, it's recommended because you're also building immunity for the child. So sometimes within pregnancy, the mother might actually get 2 doses of the vaccine, just depending on where she is within the season. Okay, so then we get into our actual pharmacologic treatments of flu. And I will just emphasize that these treatments are really reserved for patients who are very sick, hospitalized, or at a high risk. So that's high risk populations that I've referred to along the way. Most of the time, healthy individuals displaying mild symptoms typically don't require any sort of this type of treatment. But our go-tos here are going to be our antivirals. So the Tamiflu is an option that you will take for 5 days. So it's 1 capsule by mouth twice a day for 5 days. This is probably the most studied antiviral for flu, and it is proven to be safe in all populations, including pregnancy. So it is recommended that if you are infected with flu, you start to have symptoms, you're in that high risk category, that you do start taking the treatment within 2 days of your illness onset. Each of these antivirals, so they actually work to stop the replication of the virus. So they don't actually kill the virus within your body, they kind of halt it. And that gives your immune system time to attack and get rid of the virus itself. So that's how each of these antivirals are going to work. Tamiflu is really convenient because it is available in the pill form, and these capsules can also be opened. So if you have a problem swallowing capsules, you can open it and mix it in with some liquid and take it that way. Additionally, Tamiflu also comes in a liquid suspension. So again, for kids or people that might have problems swallowing pills, it's a really good option for them to be able to get treatment. And then I also wanted to highlight down here the Xofluza. So this is a newer medication that is actually a one-time dose. And I point this out because I'm actually seeing it more and more used in my pharmacy, but it's a one-time dose. And again, for those patients that are meeting that criteria for being high risk. The other options that we have here, the Relenza and the Rapivimab, also good options, but typically I really haven't seen those, and they're also very expensive. So you are likely not going to see those options, but they are out there and they have proven effective for treating flu in these populations. So then we get into RSV, and so this is respiratory syncytial virus. This is a common respiratory virus, usually causes mild cold-like symptoms, but it most commonly affects our pediatric population, our younger children. And basically, the reason why is because of where it's attacking in the body. So this primarily affects the small airways. And so because children already have very small airways to begin with, the effect is kind of more dramatic because they already aren't able to get as much air in. And so when you're having inflammation, they are going to have more issues with this. We do also see this affect our older population as well. And again, that's just because that immune system is starting to weaken as you get older. So it affects a significant amount of children every year, about 2 million outpatient visits in children less than 5 years old. And then even within that age group, up to 80,000 hospitalizations. So it can be pretty significant in this patient population. So risk factors are going to be low birth weight. Again, those pediatric patients that probably have not had time to really build up their immune system, daycare attendants, or living in a crowded condition where you're really going to be in close contact with those respiratory droplets where that virus can really spread. And exposure to air pollutants such as like tobacco, those are things that can damage the airways over time. So just all things to keep in mind with your kids that might develop RSV. And the peak season here for this virus is going to be similar to flu in that fall to spring range. And so looking at how this spread, it's really the exact same as flu. You're going to have those respiratory droplets that are going to be expelled into the air whenever you're coughing or talking, and then touching those contaminated objects and then inoculating yourself with that virus. So this virus can also be transmitted before symptom onset. Again, that's about 2 days before and up to 3 to 8 days after infection onset. And infection typically resolves within a week or two. And I will say symptoms in this population is probably going to be harder to judge because some of these kids probably aren't able to put their symptoms into words to tell us what's wrong with them. So a lot of it's going to be observation. So if we notice that the child is not eating as well, if they seem very irritable, if their breathing becomes shallow or labored, those are all different signs that the child might be experiencing this sort of viral infection. So when we look at how we manage this infection, it is really supportive care, which is basically treating the symptoms. We do not have a vaccine for RSV, and we also do not have really, there's only one approved drug to treat RSV, and it is only for high risk premature infants that are hospitalized. So we are not going to see any specific treatment for RSV outpatient, but again, treating those symptoms. If our child has a fever, then Tylenol is a go-to. If they're having pain, Tylenol or ibuprofen are both really good options, and both of these do come in children formulations that you can get over the counter. And the dosing is different than for adults. So it is important to know, again, the age of your child and maybe how much your child weighs to be able to give a safe dose to them. And again, we're going to use these methods as needed. Some other supportive care methods that we can use is the cool mist humidifier, and that's basically just going to put more humidity in the air, soothe those irritated nasal passages within the environment that the child is living in. We can also use nasal saline if the child is congested. That'll help break up some of that. There's also the little suction bulbs that can help pull out mucus as well. And then hydration is a really big piece of recovering from any infection. So making sure your child is hydrated. Pedialyte is a really good option as well. I will say, just in general, just to know, good knowledge is for children, we want to avoid aspirin. Aspirin is a common over-the-counter NSAID that a lot of people might substitute for ibuprofen, but aspirin is really not very safe for children as it has a severe side effect of Ray's syndrome. So definitely want to avoid any sort of aspirin in children until they get probably 12 and older. All right, so then we go to COVID-19, very, very prominent within our lives in the past few years. So this is a highly contagious respiratory disease, belongs to the coronavirus family, and the specific one that accounts for COVID-19 is the SARS-CoV-2 virus. This was identified in December of 2019 and declared a pandemic in March of 2020. So the difference between it being a pandemic and an epidemic is that this is affecting countries worldwide, multiple countries at a time. As you can see, COVID, and there's more cases still to this day, but as of December, we had almost 600 million of cases of COVID that we've seen over the past few years. And within that, we've had more than 6 million deaths worldwide of COVID. And so very, very impactful virus that we've been dealing with recently. So again, our high risk populations are going to be those populations where the immune system is going to be affected. So our adults 65 and older, if you have any sort of neurological disorders, pregnancy, those other chronic health conditions and autoimmune disorders all predispose you to having a more severe reaction to COVID. So when we look at COVID, same as with flu, there are many different variants, and I'm sure you've heard of these different variants just because of the amount of vaccines that we've had to get and all of the media that we see on a daily basis. But we started with the alpha and beta variants. They really came out honestly at the beginning of the pandemic, and they've kind of started out everything. They were designated variants of concern, and so that is why COVID was even brought into the limelight, because these variants were the ones that really started infecting people fast. The percentage there, these variants were 50% more contagious than any coronavirus that had been known to infect humans up until that point. So that's a pretty significant difference from anything that we had dealt with before COVID entered into the world. And so then we go to Delta. This came into the picture approximately 6 months later in June of 2021. And it caused more severe disease in people who weren't vaccinated. So this was around the time where we were still kind of developing a vaccine and getting it out there. Some people had been vaccinated, some people hadn't. And we really saw a huge impact in our population that wasn't vaccinated. And also, as it developed from alpha to beta to delta, this became much more transmissible. And so being able to spread more easily is how we started seeing a lot of infections taking off. And then when we get to Omicron might as well have just been its own little virus in itself, because this one was actually 50% more transmissible than Delta, making it 100% more transmissible than the alpha and beta variants. So just to put this into perspective, for if you're in a room and somebody is infected with the Omicron variant, they can cause 20 other people in that room to be infected. And so that accounts for why we saw that huge spike in December of 2021 when seeing multiple people getting infected with the Omicron variant. There have been a couple other variants that were out there along the way, but these were probably some of the key ones that you all might remember. And to this day, it's really just Omicron that's in circulation. Those other variants have actually phased out. So all of the vaccines that we have, the bivalent vaccine specifically right now, is actually developed really well to protect our population against that Omicron variant. So this spreads just like RSV and flu, again, through those respiratory droplets and through touching the contaminated objects and then inoculating yourself. Contagious wise, so symptoms onset can occur within 2 to 14 days of exposure. That's a big time frame that you might be able to see symptoms. So that just shows the variability of this virus. It can be, again, transmitted before symptom onset and up to 10 to 20 days after onset or after infection. So you can see that this is a virus that can really linger. So it is really important to be aware of your practices and of your symptoms that you might be experiencing so that you can prevent the spread. Again, the symptoms here are a wide range of symptoms. So fatigue is a really big one, fever, the loss of taste was really big with those earlier COVID variants, and body aches as well. So as we know, there are a couple of vaccines that we have now for COVID. Novavax is actually a vaccine that recently came into the picture, but we've seen Pfizer, Moderna, and Johnson & Johnson from the very start. Again, we have our rapid tests, which are typically taken at home, and we have our PCR test. Again, the rapid test will give results within 15 minutes. The PCR is going to take a couple of days. There are a couple of blood tests that we can actually take in the hospital. So if somebody has to be hospitalized for COVID, they can run a blood test to show if they're infected. But that blood test is actually a little less specific because it'll show if you've ever been infected with COVID in the past. So, you know, the lines can be a little blurred there, which is why we don't typically use it. And then treatment wise, there are multiple different treatment options out there. I really wanted to highlight the outpatient treatment options that you might one day see if you're living in the community and you need to have something to take at home. So Paxlovid is one of those big ones that we've seen used recently. And I do just want to highlight some of the controversial medications that were presented throughout the pandemic. So hydroxychloroquine, ivermectin. So I know people to this day still believe in those drugs and still take them, but research actually shows that they really do not achieve a significant improvement in symptoms. And so because of that, they're not indicated nor recommended for treatment of COVID-19. And so when should you get vaccinated? I think this is a little bit more iffy with COVID-19 because we are constantly updating the vaccines. So as soon as the most recent vaccination is available, that's when you should get vaccinated. Right now, it's the bivalent vaccine. So if you've had your primary series of the COVID vaccine, then you should go ahead and get your bivalent booster as soon as you can. Again, these vaccines are very accessible to the communities now. So again, the health department, community pharmacies, clinics, you can find a COVID vaccine pretty easily nowadays. And I put this website here if you do want to see the availability near you, vaccine.gov. We'll show you COVID vaccines, flu vaccines. You just enter your zip code and it'll pull up different places for you to go. All right, and so then I want to point out here just a little bit about what vaccine you should get. And so again, as I recommended, the bivalent booster is the primary vaccination that you should be getting now. And really, there is a vaccine for everybody 6 months and older now. So if you've had your primary series, the primary series is 2 doses separated by at least a month. Then after that, you will wait another 2 months and you'll be eligible for your bivalent booster. And this is really the recommendation for our patients that are non-immunocompromised or not high risk. So if a patient is immunocompromised, again, those patients that might be receiving active treatment for cancer, HIV treatment, those patients actually require an additional dose. So if you are immunocompromised, then in total, you would want to have at least 4 doses of a vaccine. So it's a little confusing and things keep changing. So if you ever have any questions or if you're ever in doubt on what to get, just speak to your local pharmacist and they will gladly recommend something for you. So going more into treatment, as I mentioned, Paxlovid is really one of the big outpatient treatment recommendations that we're going with now. And it is a tablet you will take by mouth twice daily for 5 days. Again, for outpatient treatment, people that will be receiving this are going to be those high-risk patients greater than 65 years old, immunocompromised, a lot of comorbidities, or if you are greater than 50 and you are unvaccinated, you are also considered high risk for COVID. High risk for really hospitalization and for more severe illness. And so that's when you might see that you are prescribed Paxlovid. If you are relatively healthy, you really do not need to take this medication. Again, those supportive care measures, getting hydration, taking something for the fever, for pain, that's really your best route to go. I will say with Paxlovid, it is very important that you discuss with your provider or your pharmacist what other medications you take. Paxlovid is an antiviral that has a lot of drug interactions with a lot of common medications. So for instance, if you take a statin, It's typically used for high cholesterol. You should not be taking Paxlovid, or you should at least hold your statin so that you don't have that drug interaction. Some other common interactions are going to be with blood thinners. So if you take Eliquis or Xarelto, you're going to want to be sure that you discuss that with your pharmacist or your provider so they can properly adjust the dose of your blood thinner. And then another common one is opioids. So with a lot of our pretty much every opioid, there is an interaction with Paxlovid. So being sure that you're aware of what you're taking and really taking control of your regimen. Another option that can be taken outpatient is the molnupiravir. So that's also a newer one that can be taken outpatient. Really haven't seen a lot of it, but again, it has been proven to be effective in treating COVID in this setting. And remdesivir and dexamethasone. So these are really the standard of care inpatient. So once a patient has reached that threshold of needing hospitalization and especially needing oxygen support. So that's when you'll see a patient put on mechanical ventilation where they are really not getting adequate oxygen on their own. This is when we will bring on these drugs. They've proven to be really effective in this patient population. So we'll typically see them inpatient. So then we go to prevention, which is just as important as vaccination. So if you ever feel that you are having symptoms of COVID or any of these viruses, it's just important to stay home. Again, you can see from the timeline that I laid out with each of these viruses, you can be infecting patients before you even realize that you're infected yourself. So stay home if you're not feeling well. Avoid contact with other people who are sick, even if it's a family member, kind of quarantine them in their room. Really just keep your distance because again, you're not going to be any good if everybody in the house is infected. Clean and disinfect surfaces often, especially those high touch surfaces. So door hands, light switches, your phone, your laptops, remotes, those are sorts of things that you want to be sure you're disinfecting often. Again, washing hands. I know this was really a big focus during the pandemic, but at least washing for at least 20 seconds and making sure you're drying with a clean towel. And again, avoid touching your face, your mouth, your nose, your eyes. Those are the easiest ways to infect yourself. So be really cognizant about what you're doing, especially when you're out in public. And then just to kind of wrap it all up, so as you can see throughout this presentation, these viruses present very similarly and honestly last about the same amount of time. So I think the key point here is to stay home and seek care if you need it, because you really don't know what you might have. And again, you can just see, as I've highlighted there, a lot of these, they're the same across the board. So again, just take care of yourself. And so to wrap it all up, as we've seen, flu, RSV, and COVID-19 are common respiratory viruses that affect our population every year. Most mild cases can be managed with those supportive care measures, and vaccination and those proper sanitary practices are really crucial in preventing the spread of these viruses. And so with that, these are my references. And what questions do you all have for me?
Ms. Holdren, I have gotten different, it depends on the pharmacist. How often should you get boosted? Because I've talked to about 3 and everybody is different.
Yes. So I would say go with the most recent recommendation that's out there. And right now it is saying the bivalent booster, if you have not received it, that is the one that you should be receiving. In terms of the time frame, moving forward, I think that is something that we are still learning of because they keep changing the makeup of the vaccine. So I could see us moving forward having an annual vaccine, but right now that's kind of you know, in a gray area. So I would say the best recommendation is to, if you've not received that bivalent booster, go ahead and get it and then wait for the next guidance.
I have a question. The bivalent booster, is there another name or a number that the pharmacists use? Because on my card, which I thought that's what I was getting in October, it says Pfizer GJ2524. What does that mean?
So what you'll see on your vaccine card is going to be the brand of the vaccine you got. So whether that's Pfizer or Moderna, and then those letters and numbers, that's just the lot of the vaccine that you got.
Okay.
So basically the batch that was manufactured. So that's what that means. But right now in just about every community pharmacy, all they're offering is the bivalent vaccine. So if you've not had your primary series yet, you're likely going to have to go to the health department or a physician's office to get that, because most community pharmacies are only offering bivalent right now.
Okay. Thank you.
Yeah.
So question, lots of friends, family who've been vaccinated end up getting COVID. And you know, the word that I read and hear is your conditions are still going to be better given the fact that you were vaccinated. But you know, is there anything different just to make sure that people know they still need to get vaccinated?
Yeah, so I guess I can, one way to explain it is that you can either, I mean, there's always that risk of being infected. It's even with flu, even if you get vaccinated, you still have that risk of being infected. However, what vaccination gives you is a baseline immunity to be able to fight the infection on your own. So if you've not been vaccinated and you become exposed to this virus, you have no immunity, then your body's going to have a harder time fighting that virus. And now that the virus, especially with COVID, has just changed and become stronger and more infectious, then that is going to be harder for you to overcome on your own. So basically, with the vaccine, some protection is better than none. And it has been shown with research throughout the pandemic that patients that do get infected typically have less severe infections. So your symptoms aren't going to be as severe and you're often not going to require hospitalization. And so that's the really important part, is preventing getting to the hospital. Anytime you enter a hospital, that increases your risk of any sort of adverse health effect in general. So you never want to become hospitalized. Stay out of the hospital.
The CDC was collecting lots of data during the early vaccination process, and it was pretty evident that there was particularly for over 65 population, a pretty significant decline in effectiveness of the vaccine after 6 months.
Yeah.
Are we still getting that kind of data that tells us that those of us who were vaccinated in September should be looking for a spring vaccination? Or is that something we're just all waiting to hear about?
So I will say, from everything that I have seen and read, the vaccine, the bivalent vaccine that is available right now is actually very effective. And it should get us through for a while, because the primary variant that is circulating is the Omicron, and that is what that vaccine is protecting us against. However, given the history of this virus, how fast it has replicated and changed throughout the course of the pandemic, I would not be surprised if we do have to get another booster as we enter the summer months. I know that research is ongoing in that area, and I am 100% sure that they are right now developing a stronger vaccine. So, you know, I would just kind of be prepared for anything moving forward.
So in this time frame, as we decline in the normal flu cycle, is the recommendation, I'm doing it, but is the recommendation that we mask up because of the unknown?
I would say if you are 65 and older, if you know that you have any of those chronic conditions that I mentioned throughout the presentation, just in terms of your own personal safety, it is best to wear a mask in public. Again, this flu season, RSV, all of the viruses have been elevated this season. So I would say for your own personal protection, if you are in a public area, that masking is going to be the best thing to do. Even though they say, they say you don't have to, I would say personally, I would recommend masking.
Thank you.
So I think I have had 3 boosters. Are you saying that we should have to get another booster?
You might, yeah. Again, because the virus could very well change and kind of adapt and evade the defense mechanism that we are putting up with the vaccine. So I will say, like, moving forward, you might have to get another booster, but there's just so much unknown, and there's a lot in the works still that we're not aware of.
Thank you.
One more question. Can a child, particularly say around the age of 4, can they be infected with RSV more than one time?
Yes, yeah. So a lot of the times I read that by the age of 2, most kids have been exposed to RSV. And so as they continue throughout that development stage, up to 5 and older, really, you can get RSV multiple times. So yes, just like flu, it is something that can definitely pop up a lot.
And does it seem to have a lasting effect? I have a grandson that was infected with RSV, a daycare attendant. And it took a while for him to really, come around and be back himself. But then you continue to go back into the daycare where there's so much in it, and it just seemed to have taken him a long time to actually fully recover.
Yeah, I will say most of the time with kids, their immune system it's a little bit stronger than ours. While it is developing, most of the time they are able to get over infections easier than we are. But with RSV, from what I read, it typically should resolve within 2 weeks. However, if your child is going back into that daycare where the virus might still be circulating, then that would probably make it harder for them to get over it quicker. So it really just depends on, what's going on in that daycare and the practices that they're using to prevent spread in the daycare.
All right.
Thank you.
Ms. Holdren, another question about RSV. On the news, especially up north, they had school systems in the past few months. They talked about the combination, flu, RSV, COVID. Mm-hmm. So RSV, I know it's not new, but is it because of the pandemic, because we are not wearing our masks like we used to, because we feel we are okay, that RSV has spiked? What's the reason for RSV just going all over the place?
Yeah, I think some of it is because, again, we saw during the pandemic that RSV and flu were the lowest they have ever been. And again, a lot of that is because we were quarantined, we were doing those protocols, wearing a mask, sanitizing regularly. And honestly, I feel like during that time, the virus just adapted. Because we were doing more, the virus figured out a way that it could do more and it could overcome that. And so now that we are full forced into, regular life again, we've seen a spike of RSV like we've never seen before. Also, RSV hit a lot earlier this year than it typically does. And so I think because of those measures that we, like you mentioned, we did, and now that we're not doing them, it really did open us up to have those spikes. Even with flu, we've seen a pretty decent flu season this year. I think all of that kind of plays into those practices.
Thank you.
Mhm.
Are there any more questions from anyone? You may unmute.
Well, this may be a crazy question, but when you were talking about the flu and, the standard dose and the high dose, your doctor will probably decide whether you should be, take the standard or the high, or depends on, again, what other things that might be going on with you.
So your pharmacist actually, so say you go to a pharmacy and you get your flu shot, your pharmacist can recommend whether or not you qualify for the high dose. So that's something you can talk about with virtually any healthcare provider, and they'll be able to give you guidance on that.
Okay, thank you.
Yeah.
Yeah, my confusion, and I would assume others have it also. I think maybe 6 weeks ago, not feeling well. I've had all the boosters, I've had the flu shots. And basically, when you go to the clinic to see the physician, because the symptoms pretty much kind of overlap. And the way it was explained to me, you just basically had to have the test done to confirm, because I was like, well, how do I know, is this flu or is this COVID? And can I get a strep test done? And, everything came back negative. But again, it just seems like a lot of the symptoms are just overlapping, and with uncertainty to be able to clarify, what it is.
Yeah, and that's really what makes it hard, especially during this time of year when they're all circulating in a pretty rampant numbers. It is really hard to kind of differentiate between them. So that's why I think it is really important, if you are having symptoms, again, you can go to the doctor and they can test you and they can write you a prescription. But ultimately, if you're having mild symptoms, you can really overcome that by just staying home, getting the rest, doing those supportive care measures, treating the fever, the pain. And typically it will be resolved. If you do the right things on your end, you can definitely overcome these viruses.
Thank you.
Yeah.
Ms. Holdren, we thank you, and we see you right now getting your degree in May. And we wish you well. You already spoke of who you have a job with. And we want to thank you so much. Dr. Brown from Hope, is that you?
Yes, it is.
Yes, go ahead and say something.
Danielle, you did an amazing job. Too bad we won't be able to have her here in Richmond, but she is a major asset to the profession, so I'm happy to have her.
Thank you.
Thank you, Dr. Brown. And as we stated, Hope Pharmacy. And Dr. Brown, you're famous. I mean, newspaper, I mean, everything. You're just, see you later. Have a good evening, everyone.